أعزائي طلبة المرحلة الثانية، السلام عليكم ورحمة الله وبركاته. اليوم عندنا أول محاضرة من محاضرات الهيد أند نيك الفصل الثاني، وراح تكون هذه المحاضرة عن الاناتومي of the scalp and face. First, the scalp أو فروة الرأس. The scalp consists from 5 layers، يعني تتكون من 5 طبقات. From superficial to deep, these layers are the skin, connective tissue, aponeurosis, loose areolar tissue, and lastly, the deepest one is the periosteum that lie or that cover the bone of the skull. قاعد نشوف أنه layers of the scalp، يعني بداية كل كلمة راح ناخذ الحرف هو يسوي لنا هو نفس كلمة السكالب، يعني راح تكون ال S of the skin وال C of the connective tissue وال A of the aponeurosis وال L of the loose areolar tissue and the P is the periosteum. راح تفيدنا انه نتذكر layers of the scalp. So these are the 5 layers in general of the scalp. These are how they are appear on gross examination of the scalp. As we said before, this is the skin. Next to it is the connective tissue and aponeurosis, loose areolar tissue, and lastly the periosteum, or another name is the pericranium. قاعد نشوف هنا انه pericranium is covering the skull bone. First, we will take the skin of the scalp. What are the features of the skin of the scalp? First of all, it is thick, hair-bearing, it is hairy area, hair-bearing, يتميز بوجود الشعر, and it contains numerous sebaceous glands. يعني هناك غدد دهنية موجودة بكثرة. contains numerous sebaceous glands، وهذه لها أهمية خصوصا بوجودها في skin of the scalp. So these are the features of the skin of the scalp. So it is thick, hair-bearing, and contains numerous sebaceous glands. The next layer, which is the connective tissue of the scalp, that is next to the skin. This is the skin, and this is the next layer, which is the connective tissue. This is in the yellow color. First of all, it is fibro-fatty. It means it contains fatty tissue and fibrous tissue. So it is fibro-fatty. Contain numerous arteries and veins. يعني نشوف هنا numerous veins and arteries, so it have a rich blood supply. لذلك أنه راح تكون جروح السكالب راح تكون it will bleed profusely، يعني تكون تنزف بغزارة. Why? Because this tissue اللي هو connective tissue of the scalp contain numerous arteries and veins. Also, there are fibrous septa that are uniting the skin to the underlying aponeurosis. يعني قاعد نشوف انه هي هذه الطبقة اللي هي طبقة ال connective tissue of the scalp is fibro-fatty containing numerous blood vessels. هاي اللي باللون الأحمر والأزرق contain numerous blood vessels, and there are fibrous septa هذه اللي هي باللون الأخضر، هاي الحواجز. هذه تربط لنا ال aponeurosis اللي هي تحت هذه connective tissue ويا السكين اللي هو above, connecting these two layers. These are the fibrous septa through this connective tissue that are connecting the skin to the underlying aponeurosis. The next layer, remove the skin, connective tissue, then we will find what we call the aponeurosis or epicranial aponeurosis. هذا هو هذا اللي باللون الأبيض. It is a tendinous sheet، يعني كأنه هو insertion لعضلة. tendinous sheet that unites the frontal and the occipital bellies of the occipitofrontalis muscle. هذه هي العضلة. هاي العضلة تنتهي بهذا الأبونيوروسس. طبعا lateral margin of the aponeurosis are attached to the temporal fascia. هاي الجهة اللي هي lateral عندنا fascia نسميها temporal fascia. So the lateral margin of the aponeurosis are attached to the temporal fascia. هذا هنا أنا قاعد نشوف أنه how the frontal belly and the occipital belly are attached to this aponeurosis. راح تكون هاي اللاير هي هاي aponeurosis or the epicranial layer is limited in front and behind by the origin of occipitofrontalis. هذه هي بداية الفرونتال belly of occipitofrontalis، وهذه هي بداية occipital belly of occipitofrontalis. فلذلك راح تحد هذه هي الطبقة اللي هي الأبونيوروسيس. anteriorly هو origin of the frontal belly and the posteriorly is the origin of the occipital belly of occipitofrontalis muscle. It extends laterally, as we said before, as far as the attachment of the aponeurosis to the temporal fascia. There is a subaponeurotic space. ما تحت هذه الأبونيوروسيس there is a potential space. نسميها subaponeurotic space is the potential space beneath the epicranial aponeurosis. إذن هذه هي الطبقة الثالثة. بعد ما if we remove the aponeurosis we will find a layer of loose connective tissue. loose connective tissue طبعا هذه هي اللاير اللي هي بالبلو كلر خلينا نبينه loose areolar tissue. It loosely connects the aponeurosis to the periosteum of the skull. هاي الطبقة الرابعة طبعا. It loosely connects the aponeurosis to the periosteum of the skull. راح تكون هذه الطبقات الثلاثة اللي هنا فوق يعني السكين والconnective tissue والaponeurosis they are bound tightly يعني تقريبا يعني مدمجات كطبقة واحدة يتحركن كطبقة واحدة على طبقة اللوز areolar tissue على طبقة اللوز areolar tissue. ليش؟ لأنه اللوز areolar tissue is loosely connects the aponeurosis to the layer below اللي هي البريكرانيوم أو البريوستيوم. إذن هذه الطبقة راح تعطي مجال هذه الطبقات اللي هي أعلى من عندها تعطيه مجال للحركة. It contains some important emissary veins. هذه طبقة اللوز connective tissue contain these emissary veins. هذه emissary veins تتميز أنه they are valveless. Valveless it means يعني it have no valve. These veins contain no valve. يعني معناها إذا ماكو valve it means it will permit the blood to pass in two direction. بالتالي أنه these emissary vein اللي هي موجودة بهاي اللاير it will connect the superficial veins of the scalp with the diploic vein اللي هي موجودة بالسكال بون و in the intracranial venous sinuses. يعني راح تربط لنا خلينا نقول extracranial veins with the intracranial veins. How? Through this cross section or coronal section. قاعد نشوف هنا هذه هي طبقة اللوز connective tissue. These are the emissary veins connecting the veins of the scalp in the connective tissue to the diploic vein. diploic vein هي الفين اللي هي داخل البون يعني داخل البون of the skull نسميها diploic vein with the venous sinuses اللي هي الانتراكرانيال اللي هي داخل الجمجمة with the venous sinuses. So these are the importance of this emissary vein أنه connecting the extracranial vein with the intracranial venous system. Next or the last layer is the pericranium أو هو نفسه هو البريوستيوم. هذا اللي هو هنا باللون الأخضر pericranium or periosteum. It covers the bone and at the sutures it will become continuous with the periosteum or the خلينا نسميه endosteum that is covering the skull bones from the inside. إذن هي هاي الطبقة اللي هي تغطينا العظام سميناها البريكرانيوم أو periosteum. تكون مستمرة at the suture with the endosteum that is lining the bone from the inside. Now we reach to the nerve supply of the scalp. Nerve supply of the scalp, mainly it is supplied by branches from the fifth cranial nerve. Fifth cranial nerve اللي هو trigeminal nerve. Trigeminal nerve supplying the scalp and the face. Here we can see these are the green color and blue color and the pink color. These are the branches of the fifth cranial nerve. طبعا الفifth cranial nerve هو trigeminal nerve ونرمز له بالرقم الروماني اللي هو الرقم 5 اللي هو V. فلذلك راح تكون هذه these are the branches of the trigeminal nerve راح نرمز لها بال V1. It have three branches trigeminal and V2. ال V1 هو الophthalmic nerve وال V2 هو الماكسيلاري nerve وال V3 mandibular nerve. قاعد نشوف انه كل nerve يعني راح يغذينا فد منطقة معينة throughout its branches. طبعا بقية scalp will be supplied by the cervical nerves. قاعد نشوف هنا عندنا nerve supply of the scalp. عندنا these are the branches of the V1 يعني branches of the ophthalmic nerve اللي هي supratrochlear nerve. Supratrochlear nerve near the midline supplying the scalp near the midline يعني supplying the forehead and the scalp to the vertex اللي هي هنا المنطقة العلوية للسكال. هذا هو supratrochlear. Next more laterally is the supraorbital nerve. Both of them are branches of V1, branches of the ophthalmic nerve of trigeminal. Zygomatic-temporal nerve, which is a branch of the maxillary nerve, V2, supplying the temple here. More posterior, we have a branch called auriculotemporal nerve, which is a branch of the mandibular, هو ال V3, البرانش الثالث للtrigeminal nerve, supplying the area just in front of the auricle, also supplying the auricle, the external acoustic meatus يعني القناة السمعية الخارجية, and also it supply the tympanic membrane. Tympanic membrane اللي هو غشاء الطبلة. إذن هذه this region of the scalp supplied by branches of the trigeminal nerve يعني من ال V1 وال V2 وال V3. More posterior, just behind the auricle and above it, we have a nerve that is called lesser occipital nerve, which is a branch from second cervical nerve. And lastly, we have the greater occipital nerve. Also, it is a branch from the cervical nerve. Greater occipital nerve, supplying the back of the scalp up to the vertex. What is the blood supply of the scalp? Blood supply of the scalp, as we said before, it have a rich blood supply. It's supplied by branches. These are called from anterior to posterior. Anteriorly, this is the supratrochlear artery, which is a branch of ophthalmic artery, which is a branch of internal carotid artery. More laterally and above is the supraorbital artery. Also, it is a branch of the ophthalmic artery, which is a branch of the internal carotid artery. Superficial temporal artery, this is a terminal branch of external carotid artery, run with the auriculotemporal nerve just in front of the auricle to supply the lateral and the middle part of the scalp. More posterior is the posterior auricular artery, which is a branch of external carotid artery supplying the area behind and above the auricle. And lastly, we have the terminal branch of external carotid artery, which is called the occipital artery, supplying the back of the scalp. Occipital artery. يعني نشوف أنه بالنتيجة أنه the blood supply of the scalp is coming from the branches of internal carotid artery and branches of external carotid artery. What is the venous drainage of the scalp? The venous drainage of the scalp is through these veins. يعني عندنا هنا laterally we have the superficial temporal vein and anteriorly we have the facial vein. راح نشوف أنه the supratrochlear and supraorbital veins, they will unite at the medial angle of the eye to form the facial vein. Supratrochlear and supraorbital. vein. They will unite to form the facial vein. And the superficial temporal vein and the maxillary vein will unite to form the retromandibular vein. And the posterior auricular and the posterior division of retromandibular vein will form the external jugular vein. So these are the main veins that will drain the scalp. This is the facial vein. قاعد نشوف أن الfacial vein formed at the medial angle of the eye by the supraorbital and supratrochlear vein, and it will drain into the internal jugular vein. And another vein, which is the retromandibular vein, and the external jugular vein. External jugular vein formed by the posterior auricular vein with the posterior division of the retromandibular vein. Retromandibular vein formed by the superficial temporal vein and the maxillary vein. What is the lymphatic drainage of the scalp from anterior to posterior? نقدر نقول أنه anterior part of the scalp is drained to the submandibular lymph node. The lateral part just anterior to the auricle is to the preauricular or نسميها parotid nodes. The area just behind or posterior to the auricle is to the posterior auricular nodes or the mastoid nodes. And lastly, the posterior part of the scalp is drained to the occipital nodes. Other part of our lecture today is about the face. There are special features to the skin of the face. First of all, the skin of the face possesses numerous sweat and sebaceous glands. لذلك انه راح نشوف انه الشيء الخاص بالجلد الوجه راح يكون انه يعني نسبة التعرق راح تكون شديدة، وكذلك افرازات الغدد الدهنية من راح تكون اكثر من بقية مناطق الجسم بشكل مميز. The skin of the face possesses numerous sweat and sebaceous glands. بعد the next to the skin, the loose connective tissue in which embedded the muscle of facial expression. راح تكون عندنا هنا عضلات الوجه. عضلات الوجه هي وين موجودة أصلا؟ هي بالloose connective tissue just beneath the skin. Next, there is no deep fascia is present in the face. There is no deep fascia in the face. Surgical scars of the face are less conspicuous if they follow the wrinkle lines. عندنا خطوط التجاعيد wrinkle lines إنه إذا أريد surgery نسوي فد surgical incision يعني فد شق جراحي surgical incision. هذا surgical incision راح يكون parallel should be parallel or should follow the wrinkle lines خطوط التجاعيد. ليش؟ لأنه إنه راح تكون إنه surgical scar of the face they will become less conspicuous يعني راح تكون يعني هذا الندبة بعد العملية الجراحية راح تكون فد شيء كلش قليل أو غير منظور إذا كانت شنو if they follow the wrinkle lines. If we remove the skin we will find the facial muscles that are in the loose connective tissue. هذه هي الفيشيال muscle. طبعا اكو عندنا جروبين من العضلات، اكو عندنا جروب اللي هي نسميها الفيشيال muscle، اكو عندنا جروب يسموها المسل اوف ماستيكيشن عضلات المضغ. هسه احنا here we are concerned just with the facial muscle. هذا الفيشيال muscle اللي واحدة مننا قاعد نشوفها اننا تترتب حول الأورفيسز in the face يعني الأورفيس of the eye. راح اسوي لي في الدائرة هاي العضلة اسميها orbicularis oculi. Orbicularis orbical it means circle, oculi it means related to the eye. So orbicularis oculi it will guard the eye يعني تحرس لنا العين. orbicularis oris هذا اللي تحيط لنا بالفم. كذلك تتجمع العضلات حول النوز. So this muscle will become arranged around the orifices of the face, around the eye, around the mouth, and around the nose. And there are another muscle that assist in the facial expression، يعني راح تساعدنا بتكوين تعابير الوجه، تعابير الوجه. وموجودة هنا، احنا مطالبين بس فقط بتعداد الأسماء، يعني أماكنها وتعداد الأسماء. يعني من هذه العضلات مثلا هنا عندنا هاي العضلة قلنا عليها هي الأوربيكولاريس أوكيولي، هذه الأوربيكولاريس أورس. Another muscle that elevate or depress the lips، هاي من عندها يسموها مثلا zygomaticus major، zygomaticus major، zygomaticus minor. مثلا levator labii superioris، هاي اللي يسمونها elevation lip. عكسها موجودة عندنا depressor anguli oris، depressor labii inferioris، mentalis وإلى آخره. عندنا مجموعة عضلات، وكذلك مجموعة من العضلات around the nose، مجموعة من العضلات around the eye, around the mouth and around the nose. هذه هنا طلع لنا يعني تقريبا كل عضلة بلون شكل. هذه هي الزيغوماتيكس زيغوماتيكس ميجر، هاي الزيغوماتيكس ماينر، هاي الليفاتور ليبياي، ليفاتور ليبياي. وهذه اللي هي بالعكس هذه هي المنتالس، وهذه ديبرسر ليبياي انفيريورس، هذه ديبرسر ليبياي، ديبرسر انجوليورس وإلى آخره. هذه العضلات تشترك أنه شنو بالنيرف سبلاي. The nerve supply of the face in general, we have the sensory nerve supply واللي هسه راح نحكي عليه is through the trigeminal nerve اللي هو fifth cranial nerve. Sensory supply general sensation to the face، يعني pain, temperature and touch. And we have motor supply to the muscle is through by facial nerve اللي هو seventh cranial nerve through its branches to supply muscle or facial expression. هنشوف هنا this is the nerve supply of the facial muscle، يعني motor supply to the facial muscle through branches of the facial nerve. This facial nerve passing through this gland اللي هي يسموها parotid gland, and then it will send its branches. These are the branches of the facial nerve to supply the muscle of the face. بينما sensory supply of the face is through trigeminal nerve through its three branches اللي هو ophthalmic nerve, maxillary nerve والmandibular nerve، يعني V1, V2, V3, except the angle of the mandible which is supplied by the great auricular nerve اللي هو branch of cervical ventral rami of second and third cervical nerve. قلنا posterior part is through greater and lesser occipital nerve. هذا فد مخطط colored diagram showing the areas that is supplied by the branches of the trigeminal nerve. يعني هاي اللي باللون الأخضر هي للophthalmic nerve اللي هو ال V1، هاي باللون الأزرق اللي هي area that is supplied by the maxillary nerve اللي هو ال V2، والاريا هاي اللي هي باللون الأحمر هي supplied by the mandibular nerve اللي هو ال V3 third branch of the trigeminal nerve. These are the branches of the trigeminal nerve. قلنا شنو عندنا الophthalmic nerve سميناه V1، والmaxillary nerve through which is called the V2، والmandibular nerve to the lower part of the face which is called V3. هنا بالتفاصيل راح نشوف انه ophthalmic nerve to the upper part of the face through its branches. كنا مثلا هذا البرانش this branch يعني more from medial to lateral. This is the supratrochlear nerve supplying the forehead، يعني it winds around the upper margin of the orbit, it winds around the upper margin of the orbit and upward medially until it reaches the vertex. Supratrochlear. Next, supraorbital, more laterally, and up to the, supplying the middle part of the upper eyelid and the forehead and upward. The lateral part of the eyelid is supplied by this branch of the ophthalmic nerve. It's called lacrimal nerve, the lateral part of the upper eyelid and upward. But we have the infratrochlear nerve supplying, this is the area of the bridge of the nose, and we have the external nasal nerve, external nasal nerve that's emerged in between the nasal bone and the cartilage of the bone, nasal bone and the cartilage of the bone, to supply the lateral aspect of the nose until the tip. External nasal. The second zone that is supplied by the middle part of the face, supplied by the maxillary nerve, which is the V2, second branch of the trigeminal nerve. It have what we call the infraorbital nerve, supplying the lower eyelid, zygomaticofacial nerve, supplying the prominence of the cheek, and the zygomaticotemporal, supplying the temple. The lower part of the face is supplied by the mandibular nerve, who will V3. Branches of the mandibular nerve is the mental nerve, supplying the chin and the lower lip, and the buccal nerve supplying the area on the cheek. Now we come to the blood supply of the face. blood supply in general، نقصد بالبلد supply هو طبعا شنو الارتيريال والفينوس، arterial and venous supply. As we can see here, the face in general have a rich blood supply. The blood supply of the face is derived from branches of the internal carotid and the external carotid artery. This is the external carotid artery. This is the common carotid artery. It will divide into external carotid and the internal carotid. Internal carotid will pass up to enter the cranial cavity, while external carotid artery remain outside the skull to give the branches that supply structure of the head. External carotid artery. The main blood supply is through the facial artery. This is the facial artery. Facial artery will give branches such as the inferior and superior labial artery and the lateral nasal artery and the mental artery or submental artery. Another branch is through the superficial temporal artery. هذا هو superficial temporal artery. This is a terminal branch of the external carotid. Also, it will give branches that supply the face. This is called transverse facial artery. Another branch is that's situated above the orbit here. It's called supratrochlear and supraorbital. Supratrochlear, supraorbital. These are branches of the ophthalmic artery اللي هو أصلا من داخل الأوربت. ينطينا هاي 2 branches ophthalmic artery، ينطينا supratrochlear و supraorbital اللي هي أصلها من ال internal carotid artery. فراح يكون ال arterial supply of the face through the facial artery والبرانشات اللي يعطيناها submental artery, inferior labial artery on the inferior lip, superior labial artery here. يعني نحن نشوف إنه facial artery will give 2 branches at the angle of the mouth to inferior labial and the superior labial. Inferior labial to the lower lip, superior labial to the upper lip. Next, it will give the lateral nasal artery. Lateral nasal artery. We have the transverse facial artery, which is a branch of the superficial temporal artery اللي هو أصلا يعني terminal branch of the external carotid. هذا هو superficial temporal. انطانا ال transverse facial also supplying the face. قاعد نشوف إنه الارتري they are running below the facial muscle. مثل ما قلنا عندنا supraorbital artery و supratrochlear artery. They are branches of the ophthalmic artery, which is a branch of internal carotid artery. What is the venous drainage of the face؟ قاعد أشوف أن بداية ال venous drainage هنا at the medial angle of the eye. At the medial angle of the eye by the union of the supraorbital and the supratrochlear vein at the medial angle of the eye it will form the facial vein. طبعا ال facial vein it will receive tributaries that are corresponding to the branches of the facial artery. يعني مثلا عندنا هنا superior labial vein وعندنا inferior labial vein. It will drain to the facial vein. Then lastly the facial vein will drain into the internal jugular vein. There is an important communication of the facial vein through the supraorbital vein with the vein inside the orbit يسموه superior ophthalmic vein. superior ophthalmic vein هذا راح يدخلنا لوين؟ للكرينيال كافيتي. يعني شوف هنا هذا الارتباط هذا هو الفيشيال فين. عندنا هاي البرانشز طبعا هي هاي السبراتروكيال والسبرا اوربيتال. through the supraorbital vein راح يدخل لداخل الأوربت. هذا الفين اللي هو يسموه superior ophthalmic vein. هذا السوبيريور ophthalmic vein راح يتصل وين؟ بالكافيرنس ساينس اللي هو أصلا هو inside the cranial cavity. cavernous sinus. إذا أكو عندي فد مشكلة هنا يعني if there is an infection or inflammation إذا أكو فد التهاب بهاي المنطقة it might spread يعني احتمال ينتقل خلال ال superior supraorbital vein through the superior ophthalmic vein وينقل العدوى إلى داخل الكرينيال كافيتي. يعني إذا تدخل يؤدي الكافيرنس ساينس. لذلك هذه الاريا اللي هي هنا around the nose this is called risky area. Lastly, what is the lymphatic drainage of the face؟ أقدر أقسمها أنه here the lower lip and the chin they are drained to the submental lymph node. هاي اللي هي lymph node هنا القريبة just below the chin. And the anterior part of the face it will drain into the submandibular lymph node. And on its way we have another lymph node called buccal lymph node. يعني lymph from the anterior part of the face will pass to the buccal lymph node and then to the submandibular lymph node, and lastly the lateral part of the face it will be drained to the parotid lymph node that are situated in front of the auricle. Thank you.